Government's intervention to give food items to the vulnerable in areas experiencing the lockdown has been described by many as laudable. But at some distribution centers, especially in the Ashanti municipality, residents have ignored social distancing protocols as they scramble for the free food. At the Makion Temple of the Pentecost Church at Asqa, police and military officers had to intervene. They later had to disperse the over 200 residents who failed to heed to repeated advice to space out by the officers.
What I can say is that the social distance is not working here at all, because if you see how they are sharing the food, it's good for sharing, but the security service is not helping to ensure the social distance, because if you see through the lines, they haven't observed the social distance at all. Maybe when a citizen is having the disease, he or she can pass the disease without the social distance.
Chosa omuka se yenti ensem no omuche se yenti ne yensa se be ya gap no betima de mampa ye disu ye etie ye no akire no onse ye de nipa no se be bi ono ma asondi wom etie ma mo wuro me nyina de ye de ya sa na koba na mbom ye na anka bia adwen ate ase da ye dem no de anka se mo ye bibi akire se se de akoye nyina bia ya gira mhwedo ma ya hia nyina obi anya hweti ya ye de.
Police say they will meet with leadership of the church and the National Disaster Management Organization, NADMO, on the way forward.
The numbers were very huge, and it's not only this place. We had about 4 centers: Makion, Open Bible, Prabon, Pentecost, and then Atonsu Pentecost. And all those places had more than 500 people trooping in to take this ration. Is that this disease is real, so they should adhere to advice from the health service that we need to observe social distance. That's the major problem we have today. When you try to advise them to go behind certain limits before they can come in and collect what is due them, they wouldn't even listen to you. That was the major problem we had. But by way of intervention and talking to them, we've been able to get to where we are now.
Ashanti Regional Director of the Ghana Health Service warns the current method used for distribution of the food items changed.
That is not the protocol for social distancing, because if we do it this way, people will come in an attempt to get food and they will go back with the condition that we are all fighting against. And the number of people who are coming, the way they are scrambling for the food, I think is not the best. We would rather wish that they do it from door to door. We wouldn't like them to be coming to the community and then people chasing for the food and other things. It's not in the interest of their health. It's not encouraging the social distancing. And repeatedly, if you do that, that will rather transmit the infection.
Meanwhile, officials at the Menchia North Distribution Center are involving police to track a man who allegedly incited residents ahead of distribution of the items in the area.
The military officers were here. They tried all they could, but the people didn't comply with what the military and the police were doing. So the military officers and the police officers who came here tried to speak to the leadership of NADMO and also the leadership of this particular church where the food is being shared. So they have succeeded in dispersing the people to their various homes.